you'll learn in episode 11 of the Portage Health Foundation's Addiction series, the vast majority of those suffering from addiction also have some issues related to mental health. I'm Sarah Blakely, TV6 Morning News co-anchor and your host for this series. Today we'll hear from Bernadette Yeoman-Ouellette from the Portage Health Foundation, as well as Rebecca Crane from Dial Help and Dr. Adam Frimodig from UP Health System.
Living in this community, one of the difficult aspects of living here is a lack of mental health facilities and treatment options. The addiction problem in our community just adds pressure to that. We don't have treatment facilities. We don't have availability of psychiatrists that can help people work through their issues.
I think a lot of times those two things become intertwined. If somebody has a mental health issue, I think we call it dual diagnosed. And because part of it, I think, is that people are trying to self-medicate their symptoms, especially if they're having difficulty accessing appropriate treatment for mental health. And then on the other side of it, there's a deeper layer that I think when people have acute or chronic mental health conditions, there's a lot of other things that are very painful about having that kind of disorder. In addition to their symptoms, a lot of times over time they tend to have an erosion of their friends and family support system. They have less than other people do. There's the stigma we just talked about. They might have more difficulty in relationships, difficulty maintaining employment, housing, all kinds of things, which all of those things in and of themselves are very painful. So there comes in the coping aspect of using drugs and alcohol. And of course, those things can also make emotional and mental health symptoms worse, like anxiety and depression are made worse. And of course, if you mix medication, it can actually be deadly too. So there's a very unfortunate overlapping of those two.
The biggest lack is in mental health, because I would say on a low estimate, 80 to 90% of these people with substance abuse also have issues in regards to mental health, whether it's depression, bipolar disorder, anxiety, even schizophrenia, or simple as mood disorders given the environment that they grew up in. And mood disorders can be, personality disorders, can be extremely difficult because medication doesn't work. But for all of these, counseling can have a substantial help as long as it's somebody that they're comfortable with and when they're willing to work towards it. And we do have a handful of counselors in the area that are really, really good, both substance abuse and mental health counselors. But access to them is not easy for everybody. Insurance is a barrier. Price is a barrier on top of that. But counseling is available. Psychiatric help in regards to medications, we're treating some of these more advanced depressions or bipolar, schizophrenic situations, are not as easily available. We do have a couple through Copper Country Mental Health, but there's a lot of barriers for people to be able to see these psychiatrists. Otherwise, you're often having to travel several hours or see one through telehealth, where you're talking to them through a TV screen where they're actually down in Lansing or Madison, Wisconsin, which this is still beneficial, but these are definitely the biggest barriers in dealing with mental health.
Addiction is only further highlighting the lack of mental health facilities and treatment options available in our community, but together we can advocate for a better future. In the next episode in the Addiction series, we take a step back in the process and get to know what the Western Division of the Upper Peninsula Substance Enforcement Team, or UPSET West, is trying to accomplish in stopping addiction before it even starts. If you or someone you know is struggling with addiction, know that there are resources available in our community. Dial Help is a great place to start. They have a crisis line 24 hours a day, 7 days a week, based right here in the Copper Country. Just dial 906-482-HELP, text 90635-NEEDS, or chat live with someone at dialhelp.org. If you're in any kind of medical emergency, dial 911 immediately. To learn more about the resources available in our community or to subscribe for email alerts for future episodes, just visit phfgive.org/addiction.